And all of them are true except C. The brachial plexus supplies the upper limb and not the lower limb. The nerves to the lower limb are derived from the lumbosacral plexus. When we talk about supplying the limbs, what does it mean to supply the limbs? So there are a number of different structures in the limbs. As you know, there are bones and joints, muscles, connective tissue, and blood vessels. And if we look more closely at one of the nerves, in this case emerging from the brachial plexus, in this cartoon drawing, we can imagine that within each nerve are different color-coded wires. These wires you first saw when we looked at the tissue structures in the stock room, and now we'll give each color coding a particular set of characteristics. So imagine this as a kind of power cable, like a big phone cord with different colored wires coming out from it, and each of those colored wires represents a different nerve function. The nerve fibers are processes which are projecting off the individual nerve cell. In the slide that we're looking at here, we're getting a section through the nerve cell body, and in the cell that's shown on the right, the process is disappearing out the end of the microscope slide. So we'll look at a cartoon drawing of the cells and their processes in a minute, but it's the part actually that you can't see, which is the wire, the colored wire, that's traveling through the spinal cord. There are 5 nerve fiber types, and the distinctions are made according to, first, the direction that the nerve impulses travel. Motor fibers carry signals from the central nervous system to the structures innervated, and those are usually muscles of particular kinds or glands. Sensory nerves carry signals back from those structures to the central nervous system. So the first division is between motor nerves and sensory nerves. And the second cross-cutting division is according to the structures that are innervated, more or less the clients that are served by the nerves. So if we distinguish by structures, we have somatic structures, and those are the things that we normally receive various kinds of signals from. So somatic structures include skin, bones, joints, skeletal muscles, connective tissue, and other structures in the outer part of the body. Then visceral structures are organs within the body cavities. These are the respiratory organs, gastrointestinal organs, urogenital organs, and circulatory systems. So the visceral structures include the organs and blood vessels. If you've ever had an injury in which a blood vessel was injured, you may have noticed that the quality of the pain from the injured blood vessel was different than the quality of the pain from the other structures. And this is one subjective experience of the distinction between somatic structures and visceral structures. The last category are special sensory structures, and those are the ones we often think about right away. So those would be sensation from the eye, vision, sensation through the olfactory mucosa in the roof of the nasal cavity, and sensation from structures in the inner ear, which enable both hearing and balance. If we put those two cross-cutting categories together, we have 5 nerve categories, and those would be 2 motor categories, somatic motor and visceral motor, and 3 sensory nerve categories, somatic sensory, visceral sensory, and special sensory. And we'll talk about the motor first. Somatic motor fibers convey motor impulses to skeletal muscle, and in this pathway that we'll see in a minute, there is only one neuron between the CNS and the innervated structure, the skeletal muscle. Visceral motor fibers are different in that there are 2 neurons in the pathway between the central nervous system and the smooth muscle, cardiac muscle, or gland. Visceral motor neurons are classified as either sympathetic or parasympathetic. And again, 2 neurons, one with the nerve cell body in the central nervous system, one with a nerve cell body outside the central nervous system. A ganglion is defined as a group of nerve cell bodies located outside the central nervous system. So, starting with the targets, again, the somatic motor neuron will be traveling from CNS to skeletal muscle. And the visceral motor neurons will be traveling to smooth muscle, cardiac muscle, or glands. So the impulse will begin in the central nervous system. On the central nervous system side, adorning the surface of the nerve cell body will be dendrites. Those will receive impulses from the central nervous system. The nerve cell body is connected to the dendrites, and here you can see the nerve cell body with cytoplasm, nucleus, and nucleolus. From the nerve cell body, the impulse is conducted along the axon to the axon terminal. Neurotransmitters are released at the axon terminal, which bind to receptors on the muscle, and the muscle contracts. So although the somatic motor neuron is a sprinter and travels relatively quickly, at the same time the visceral motor neuron is running a relay. So we have dendrites, nerve cell body, axon terminal of the first neuron in the pathway, and then the nerve cell body of the second will be in a ganglion outside the CNS. Synapse will occur there, dendrites, nerve cell body, axon terminal. And in this case, the neurotransmitters will be released to receptors on smooth muscle, cardiac muscle, and a gland, which is secreting. So the difference again between these two motor pathways is there's one neuron between central nervous system and skeletal muscle target for somatic motor neurons, and two in the pathway between central nervous system and smooth muscle, cardiac muscle, and glands for visceral motor neurons. So those are the two motor neurons. Special sensory fibers are found only in some of the cranial nerves. Again, these convey sensation from the retina of the eye, olfactory epithelium in the roof of the nasal cavity for the sense of smell, and the cochlea and the semicircular canals for hearing and balance from the inner ear. Somatic sensory fibers convey sensation from skeletal muscle and also from other musculoskeletal tissues, bones and joints, and also the portions of the pleura and the peritoneum lining the inner surfaces of the chest and abdominal walls. So the pleura and the peritoneum are slippery sacs made of epithelium containing a thin layer of fluid that enable the thoracic and abdominal organs to move and change size and ease their movement. Visceral sensory fibers convey sensation from structures innervated by visceral motor neurons. So again, blood vessels, thoracic and abdominal organs. Visceral sensory fibers also convey sensation from the pleura and peritoneum covering the outer surfaces of the organs themselves. So the pleura and peritoneum right on the organ are visceral sensory innervation. The pleura and peritoneum lining the chest and abdominal cavity are somatic sensory fibers. Why this matters to clinicians is that somatic sensation tends to map relatively well to the area that's irritated or injured. Visceral sensory fibers are less well localized. So it's much more difficult when you have intestinal pain to figure out exactly which part of your intestine, whereas a pain in a skeletal muscle or the skin of your side is much easier to figure out where the injury is. So the special sensory nerve pathway, in this case I've illustrated the eye. So one neuron between the eye, the retina of the eye, and the central nervous system. So peripheral processes in the retina, nerve cell body outside the eye, central process going to the central nervous system. In the case of somatic sensory fibers, these will be skin, connective tissue, structures in the joints, peripheral process going to the nerve cell body, central process going into the central nervous system, and the structure of the visceral motor neuron is exactly the same. The difference is the sources of the sensation. So instead of being skeletal, musculoskeletal structures, instead it will be blood vessels, organs, and glands. But again, peripheral process, nerve cell body, and central process going to the central nervous system. Nerve cell bodies of both visceral and somatic sensory neurons again are located outside the CNS in a ganglion. In both the somatic and visceral sensory pathways, there is only one neuron between the structure and the central nervous system. The nerve cell bodies of both neuron types will be located in a ganglion outside the central nervous system, in which there are two processes of the same neuron, and a ganglion in the visceral motor pathway, in which a synapse occurs between two neurons. So far, we've just been talking about the background that you need, the context for fitting what you'll actually apply about the nervous system to figuring out what's going on in the patient cases. So during the physical exam that you've had and during the physical examinations that the patients will receive from the orthopedic surgeons in the Anatomy X clinic, one of the things that patients are asked to do is to perform a particular motion, to contract a particular muscle, or on testing to see if they have sensation from a particular structure, including a patch of skin. So this will be a greatly oversimplified diagram of the central nervous system containing just enough information for you to get you to understanding the nerve injuries in the cases. So let's say you are working out in the gym, and that pathway begins in the central nervous system with an excitatory neuron, which synapses on a somatic motor neuron, and somatic motor neurons are often as long as the distance between the central nervous system and the muscle itself. So excitatory neuron to somatic motor neuron, skeletal muscle contracts, and let's imagine you're working out really hard, and in the next slide, you experience some muscle discomfort. So we reviewed the motor pathway, excitatory neuron, somatic motor neuron, muscle contraction, perhaps too vigorously or too often, resulting in muscle pain, and muscle pain will be conveyed back in a somatic sensory neuron, reach another sensory neuron in the central nervous system, and initiate an inhibitory response, which will stop somatic motor innervation, relax the muscle, and enable it to return to a more comfortable state. So that's a pathway in which we have central nervous system neurons involved now, very simplified, but a pathway in which the excitatory neuron to the somatic neuron, muscle contraction, pain from the muscle, back to the central nervous system, and inhibition of contraction. You hit the showers. An even simpler case is the classic case of the hand on the hot stove. So this is an unhappy patch of skin. Somatic sensory neuron goes back to the central nervous system, and this time you usually don't have to have the time to make a decision about whether to take your finger off the stove. So in this case, either directly or through an interneuron in the central nervous system, somatic motor neuron initiates an impulse, muscles contract, the finger is withdrawn from the stove, and hopefully comfort is restored. So this is a very simple spinal reflex. In examining the patients in the 5 musculoskeletal anatomy cases, some use will be made of reflex testing. So if you've had a physical examination, you may have had the attending physician tap on a tendon, either the one right under the kneecap or the one just above the heel, to see if it triggers a muscular response. So again, stretch sensation conveyed from the tendon through the somatic sensory neuron into the central nervous system. Impulse travels back through a somatic motor neuron to the skeletal muscle. Contraction occurs, and the reflex is tested. This is an important principle in physical examination because simply by tapping on that tendon with a small rubber hammer, activating stretch receptors in the tendon, and noticing whether or not the muscle contracts gives you a lot of information. So in testing this reflex, if tapping the tendon causes contraction of the muscle, then the sensory neuron is intact, the motor neuron is intact, the attachments of the muscle are intact, and we've tested 3 things. So it's a very efficient way to test sensation, motor innervation, and the integrity of the muscle itself. Very efficient and very quick. So now let's apply the information which we've so laboriously assembled from learning about the nerves, I have to confess that the nervous system is the part of anatomy that the medical students like the least. So if you found it tedious or painful, you're in very good company. Now, let's take the knowledge and apply it to situations in which we might need to make a diagnosis. So outside the scope of this course, but covered in other HarvardX courses, are things that can go wrong in the central nervous system. We're concerned in musculoskeletal anatomy X in things that can go wrong with the peripheral nerves that are traveling to the limbs. Let's go back to this slide and think of all the things that can go wrong. Anything can go wrong anywhere along the very extensive pathway of the axon of the somatic motor neuron. So it's stretching all the way from the central nervous system to the skeletal muscle that it's innervating. Similarly, sensation from that skeletal muscle has to also travel a very long distance in the peripheral process of the somatic motor neuron. What would happen if we had an injury to the axon of the somatic motor neuron? So what would happen would be a paralysis of the skeletal muscle. If a muscle cannot be moved voluntarily by a patient, it suggests either that something has happened to the muscle itself, to the muscle or its attachment to the bones it moves, or something has happened to the somatic motor neuron. And as good diagnosticians, you'll be able to figure that out in the 5 cases. Somatic motor neuron, visceral motor neurons, and visceral sensory neurons all will be running together in the nerves that supply the limbs. So for each of the musculoskeletal cases, we'll be reviewing the nerves that apply. Each of the nerves traveling to the limbs will contain all 4 nerve fiber types, not special sensory fibers, which are unique to cranial nerves in the head and neck, but all 4 motor fibers: somatic sensory, somatic motor, visceral sensory, and visceral motor. You may be wondering what visceral structures are found in the limbs, and the answer is glands, so skin glands, smooth muscle in blood vessels, and when you're terrified, the little smooth muscles in the skin that make your hair stand on end. And there's even a specific anatomical term for that: horripilation. So those would be very small visceral structures, viscerini, in the limbs that are supplied by the visceral motor fibers. So let's imagine for a moment that we have an injury to a particular nerve traveling to the limbs. If that occurred, what would be lost? So if there were a complete transection, a complete division of a spinal nerve traveling to the limbs, we would first lose somatic sensory innervation to particular structures. And a physician could test that by scratching the skin or touching the skin to see if there was a sensory loss. And the sensory loss will be relatively specific. So you will learn for each of the cases that sensation from a particular region is carried in a particular nerve to the limbs. There would also be motor loss to specific muscles. So in a case where we had a nerve injury and no real idea of where the location was, the pattern of sensory loss and the pattern of motor loss, the muscles that couldn't be used, and the skin that had lost sensation, can give us a much better idea of where the injury occurred. The pattern of sensory and motor loss can be diagnostic. If a particular region of a limb has a loss of sensation or reduced sensation, if particular muscles cannot function as they normally do, then that suggests injury to a particular nerve. Even in a case where there was no obvious injury, we could deduce from that pattern of deficits which nerve was implicated and possibly where. Following a vigorous participation in the HarvardX 5K, a 34-year-old patient presents at the Anatomy X clinic complaining of muscle pain in his left leg and intestinal discomfort. So applying everything you've just learned in a very short amount of time about the nervous system, you'll be able to determine which of the following statements are true and the one statement that isn't.